In this section, we'll be looking at the promise and limits of technology and information technology for decision-making in Nigeria. So we'll be looking at autovisual AFP detection and reporting, AVDA. As you may know, AFP stands for acute flaccid paralysis. There's a link there regarding the WHO collaboration rollout for this mobile application, and we expect that you would have read this and reviewed this particular document before this lecture. So, how does AVDA work? What does it add? I'd like you to ponder on these questions and then answer them before we go on. So it's an alternate surveillance method relying on community members rather than the health system. What would be the pluses and minuses of collecting surveillance information this way? It goes directly to you, but might miss a lot of AFP and potentially cases, as well as nearly all cases of polio, will end up at the health center at some point in time, and a random community member might be less likely to see them. In the end, one person with experience with AVDA noted, essentially, it was supposed to be health facility-based. Community-based surveillance added to completeness at some places, but with excess reporting and bad quality. Another technology that can be used for data collection is the Geographical Information Systems, which is GIS. So we'll be talking about GIS data in Nigeria. We have a quote from a global level policymaker. Kano, a city in northern Nigeria, is so dense, and there was much effort and so many resources going into it. And we were still seeing cases, and it was kind of like, well, heck, what else are we supposed to do? We thought, what if we tried to map out our communities and double check that they're all getting covered? On the slide, you can see hand-drawn and digital versions of maps of the same community. And you can see that the digital map is able to capture some areas that have been missed by the hand-drawn map. So a comment was made that even good hand-drawn maps have missed settlements, and not everything was where we thought it was. I'd like to ask you, what are the pluses and the minuses of using maps that are hand-drawn by campaign workers versus maps created from aerial photography and GIS? Can you think of any pluses to the hand-drawn maps over the GIS maps? A possible answer might be that they are reflective of the health workers' mental maps and may be more useful to them. Also, the act of making maps can help local health workers learn about their areas. I'd like to ask you some more questions. What are the cost implications? Should public health programs be more cost-sensitive? The work and quality has to be delivered on the ground. People may use aerial technology, but ground forces have to be aware of their area of jurisdiction and the populations there. Also, they need to take care of population movements and temporary populations or changing dynamics there. In this slide, we're looking at improving maps in important geographies. And it really doesn't require highly trained or sophisticated devices. You can see from this map that was taken from a local government in Katsina State in Nigeria, the improvements in the number of settlements that were identified based on the GIS map. So on the right-hand side, you can see the final map, which is more detailed. In this slide, we'll be looking at global positioning systems, which is GPS, tracking of vaccination teams. And post-campaign reports include geo-coverage, settlements visited, and percentage of total. Target population visited and percentage of total. Heat map showing visited and missed settlements. So I'd like to ask you, what are the implications of GPS tracking of vaccination teams. In your opinion, is this appropriate? One person with familiarity with this commented, technology and tracking is fine for monitoring the complete coverage. Tracking might have a negative effect on vaccinators' morale, that their movements are being tracked. Finally, what matters is 2 drops in the mouth of every eligible child. Here's another example from Nigeria. And from the tracking, improved coverage of border settlements is highlighted. So we can see that GPS is important in the polio program. This slide was showing that the GPS can direct field workers to address gaps. In Nigeria, the chronically missed settlements identified thanks to mapping and tracking were located using a Geographical Information Systems GIS map app running on a rugged field tablet. The app has a set of online imagery and base map layers and helps with navigating to the unknown settlement. The local polio officers are coming along on these exercises to make sure the settlements get included in the microplanning for the following campaigns. However, if there's a good system and ownership, vaccinators should know their area on ground. Technology use can be supplementary. So, we're going to talk about a success story, and this story is given by a global level policymaker. So I think he just brought a measure of precision to the Nigeria program in terms of microplanning and identifying missed settlements that literally had been missed by all services for years. Hundreds of settlements that just had never been in microplans for the entirety of the polio eradication effort in Nigeria. And those communities also weren't associated with any particular health center in the public health planning system. That really changed things. And I'm still working on routine immunization in Nigeria. And I still see the knock-on effects of that. They're now using the same GIS maps to create microplans in routine immunization outreach. So this is the success story. I'd like you to think about, why had these settlements been missing from the microplans? What does this tell us about local knowledge, government knowledge, international knowledge, and the efforts to eradicate disease? What would have been alternate old school strategies to the GIS methods? What would have been the pluses and minuses of these methods? So in this slide, we'll be talking about how technology doesn't eliminate the importance of politics. We have a quotation from a global level policymaker, and it says, it took years. I mean, from 2011, 2012 to 2014, 15. I'd say that finally the GIS data were being used effectively. And I think had we done it another way, the government would have owned the maps a bit better and they would have been adopted a lot easier. But that's kind of how it came about, just like, okay, what's our last ditch effort to get this done? This quote from a global partner is about how this information didn't get integrated into the government right away. The mapping was initially done by Gates Foundation and others. As this interviewee describes, it was conceived by them as part of a last-ditch effort. Think about, why might it be that this scenario would lead to government resistance to using the maps? The interviewee adds, that was our fault, and the way we went about funding that through the partners meant that it was a whole public good for Nigeria as a country. I mean, they could use that for education, planning, infrastructure, but it wasn't set up within the government system. And then getting the government to trust that data and take it on has been a whole process. It's still ongoing. So in this slide, we'll be talking about how data doesn't eliminate the importance of context. We have a quote from a global level policymaker. The question you had about why is it GIS mapping can't be applied elsewhere, I mean in Pakistan and Afghanistan, the fear is around government and or international surveillance are just too high. In Nigeria, it's accepted and it's okay. And in Pakistan and Afghanistan, the fake vaccination campaign by the CIA or the American Intelligence Agency and all that just makes it too high stakes to make it possible. So I'd like you to think about, given what options you know from other portions of this class or this module, why would this be the case? Why might what worked so well in Nigeria not work in Afghanistan? What does the interviewee mean by high stakes? A culture of data. So, what do we mean by culture of data? So, we're looking at data for decision making or data for data. And then we'll also be looking at data search. Polio has a strong culture of data. This is, as we have discussed, a strength, and it has been something other programs have drawn from. It can also lead to some complexities. First, why is data being collected and used? Data collection and analysis can and do become ends in themselves without always enough consideration of how this data will actually be used in day-to-day decision making. Sometimes a great deal of effort is expended to collect data that is never used. A related issue is the data surge. There may actually, in some cases, be too much data to use effectively.